Hi everyone, Dr. Lloyd Stegemann from the Better Way Center in Corpus Christi, Texas. One of the questions we get asked quite frequently is, are my medicines going to change, or do I have to crush all of my pills? Do I have to take liquid medicines after I've had surgery? And the answer for the most part is no. Simple things like getting a flu shot is going to be the same thing as getting a flu shot after your bariatric operation. There are certain medications with certain procedures, however, that will need to be changed. So with a gastric bypass, with a duodenal switch, those medicines that have an XL on the end of them are designed to go slowly through the digestive tract and be absorbed over time. After those two procedures, because these medicines go through much faster, oftentimes they're not absorbed quite as well. And so we often have to take a patient off the XL part of that medicine and get them to a standard length one. I think one of the great things about bariatric surgery in general is that most of the time we just get you off medications altogether. The weight loss profoundly improves your health, and many times we just get rid of medicines altogether. The big groups that we always are concerned about is that NSAID group, non-steroidal anti-inflammatory drugs. These would be things like Motrin, Advil, naproxen. These are all some common ones. For those, we do try to limit them for sure. With the gastric sleeve and the adjustable gastric band, don't worry quite as much about the NSAID classification, but even then, if patients are on them regularly, they tend to struggle a little bit with nausea. For gastric bypass patients, we certainly can see those NSAIDs being used on a regular basis causing ulcers. And the ulcers tend not to be so much the ones that hurt, they tend to be the ones that bleed. In my own personal experience, I have never seen a patient who took Advil once and had a problem. So what I recommend for my patients is not to be on them on a regular basis. Last thing I would say is we always want to watch out for medications that are associated with weight gain. And common medications would be antipsychotic medications, some antidepressant medications, certainly some birth control pills can cause it, some anti-seizure medications, steroids can cause it. Anytime we can avoid a medication and switch to a different one that is not associated with weight gain is always a good idea. Thanks for watching. If you enjoyed that video, I encourage you to come back and check out some more.